Okay, somebody did it. Okay, never
I
mind.
think Allie might be doing it then.
Yep, I just did it all.
Okay, great.
That's great.
So I have the great pleasure of introducing my former boss and mentor as today's seminar speaker. In public health research, engaging community members in the process can help better address the issues affecting the health of marginalized populations. And this can involve researchers partnering with communities being affected. And not only does it lead to a more nuanced understanding of the related health problems, it can also increase the quality of research and lead to higher participation and better interpretation of findings. But how can we measure how engaged community members feel in these partnerships? And that's what you'll be hearing about today. Our speaker is the Associate Dean for Research and Associate Professor of Biostatistics at NYU, and her research focuses on understanding social risk factors that contribute to health disparities in urban areas, with the goal of developing culturally competent, region-specific, and evidence-based solutions through collaborative activities with community members and other community stakeholders. So please join me in welcoming Dr. Melody Goodman.
Thank you all for having me today. I'm excited to talk to you about some work that we've been working on, and what Prof didn't mention is that part of her work in my lab, we were both at WashU, neither one of us are there now, I guess, is that she helped start some of the foundational work that I'm going to talk about today. I'm going to stop sharing my video just because I found that if I try to share my video and my slides at the same time, it doesn't always cooperate with me. So I will come back on once I'm done talking. So hopefully you can see my screen pretty well. And I'm going to talk to you about the development and validation of the Research Engagement Survey Tool, which we affectionately now call the REST. For those who don't do community engagement work, I'd like to just start with sort of describing why people do this work. And I think the motivation for me is really summed up nicely in this African proverb that says, if you want to go fast, go alone, but if you want to go far, go together. I think those of us who do community engaged work really sort of understand this pretty well. So I'm going to talk about the working definition of community engagement, and we use the definition from the Centers for Disease Control and Prevention. And we define community engagement as the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting the well-being of those people. And community engagement is a powerful vehicle for bringing about environmental and behavioral changes that will improve the health of a community and its members. It often involves partnerships and coalitions that help mobilize resources and influence systems, change relationships among partners, and serves as catalysts for changing policies, programs, and practices. So those of us who do stakeholder engaged research, I think, come to this for many similar reasons, but we want to ensure that our research is patient and community centered. And we have an understanding that non-academic stakeholders provide a unique perspective on needs. It also increases the relevance of research to non-academic stakeholders, whether those be patients, communities, or policymakers. It helps support sustainability of interventions post-funding. It builds capacity and trust among all stakeholders. And it allows you to leverage existing resources within the community or within your stakeholder groups. And if you do this well, you'll form reciprocal relationships between researchers and non-academic stakeholders. And we also know that this is an evidence-based approach to addressing health disparities. So why measure partner engagement? One of the things we realize is that the extent to which stakeholders in research partnerships feel engaged has not really received sufficient attention. And it is important to understand how engagement level in a partnership is developing and to what extent engagement level is a predictor of outcomes in a study. Let's say speed of recruitment or diversity of the sample recruited. Really, how does engagement impact the science? So I'm going to walk you through our approach, and we really started with a systematic review, and I'll talk about why we developed a new measure. And then we really focused on refining and validating this new measure, developing a shorter version, We're also working on a computer adaptive version of our measure. And we recently completed an implementation study to use our measure in practice. So as I mentioned, we started with a systematic review. And I'm told by my really smart research assistants that if you hold your phone up to that QR code, it will send you to the link for the papers that I'm talking about in this talk. So we started with a systematic review of the literature. And to be quite honest, when we stepped into this space, we assumed a measure already existed. We were doing community engaged work. It was part of a National Cancer Institute funded Community Network Partnership Center. And the RFA told potential applicants that they had to do community engagement. In fact, they had to do a randomized controlled trial that used community-based participatory research, which those of us who do CVPR felt like that was kind of weird. But we were able to form such a study, and our center had lots of different partnerships. And as part of the 5-year evaluation, NCI came back to all the centers and said, well, show us that the community engagement you're doing is really working. And so in our own center, we had been doing these annual web-based evaluation surveys. We initially thought we'd go find a measure of engagement, we'd add it to our survey, and we'd kind of move on. But we couldn't find anything that sort of really fit our project because it was engagement in a research study, but we also had these community academic partnership groups. We had done lots of outreach and education. So we had lots of different types of engagement going on in the center. And that meant different people could be engaged in different ways. So, like I said, we started thinking that measures existed and that they had properties that were understood. And what we found was that lots of people had measured something, but we really didn't know what they had measured, and that the field really was not very strong methodologically. In our systematic review of the literature, we sort of discovered that measures came in 2 camps, or we grouped them into 2 camps. One in which investigators simply counted the attendance in various events and activities and assumed that engagement, for example, the number of people who attended a board meeting. And we really struggled with this idea of counting attendance as engagement because we knew from our own work that people could attend. Maybe they show up for the pizza and cookies, although I guess now during COVID, that's not an option. But they could sit there through the whole meeting and not really participate. And so counting them just as being there wasn't really a measure to assess how engaged they were. And then we found that a bunch of other measures fit into another group in which investigators had measured some construct that was possibly related to engagement, but wasn't necessarily engagement itself. And I think a good example of this is one of the measures we found was the degree to which participants felt comfortable sharing their thoughts and opinions. And we took this back to our community partner group, and one of our community partners said, I can feel very comfortable sharing my thoughts and opinions. It doesn't mean I'm actually going to do that. And so we thought, okay, maybe also this is not a great measure of engagement. And what we found in the literature in general, that neither way had been validated or corroborated. Most had not been examined in relation to the outcomes of projects and research, and they were not tracked over time. So we developed our own measure, sort of out of necessity, because we needed a measure to measure the engagement that was going on in our center. And we, again, still wanted to put it on a web-based survey. So we were looking for something that was a survey instrument. And so we worked with our community academic partnership to really review the literature. And we reviewed the literature on community-based participatory research, on community engagement, on patient-centered outcomes research. We looked at community campus partnerships for health, their principles, and really brought these all back to our community academic partnership. And we decided that we would focus on 11 engagement principles that we thought were important, but also could be measured in the way that we were trying to measure engagement. And we developed 3 to 5 items to assess each engagement principle. We used the Likert response options, Likert type response options. And our community partners really emphasized to us that it was important for us to measure this on two scales. So we have a quantity scale, which measures how much, and a quality scale, which measures how well. And our community partners really talked about you can do something not great, a whole bunch, or you can do something really good, but only do that a few times. And so it was important to have a sense of both how well it was, but also how often some of these practices were done. Little nerdy side note for a nerdy statistician like me, but Dr. Lickard taught psychology at NYU. The picture you see of this report is actually the report where the Likert scale was developed. And it was developed in 1932, so it was developed here at NYU, and this report is in the NYU archives, which I just think is super cool and nerdy. And many people like myself have always called this a Likert scale, but he pronounced his name Likert, so I've tried to be respectful of that. But what he demonstrated is that a single streamlined question with a set of scaled answers was ideal if you were trying to develop a set of standardized questions. So the other thing that we really thought is that there's lots of people potentially doing engagement work, but we weren't sure how many people were actually publishing their engagement work. And what I mean by that is that a lot of people didn't consider community engagement itself a science. It was something that they were adding on to their science. And so we put out this commentary on the science of stakeholder engagement, really as a call up for action, trying to get other people to publish the work that they had done in this space beyond maybe a couple of sentences that they were putting in their sort of outcomes papers. And we really talked about how we would think about it in terms of classifying engagement, implementing engagement, and evaluating engagement. And in that paper, we used this figure and borrowed the categories of non-participation, symbolic participation, and engaged participation from work that had already been done in the engagement literature. But people who were doing outreach and education sort of didn't really like the idea that they were in the non-participation bin. And then the idea that people who thought they were really doing meaningful collaboration were in the symbolic participation bin didn't like that as well. But what I will say is that a great way to get people to start releasing their measures is to do something they don't like, because people will start to talk about it in the literature and in other spaces. So simultaneously, the National Institutes of Health released a call for applications looking for research in this space. We did not get funded by NIH, but we did get funded by the Patient-Centered Outcomes Research Institute to move our work forward. And I say that because it means that lots of people are sort of working in this space simultaneously, which I think is really great for where we are in terms of thinking about this as a science. And so the goals of our PCORI funded project was to examine the construct validity of each of the engagement principles on both scales, and we use a standard Delphi process to do that. And I'll talk about that more. We also wanted to examine the psychometric properties of the measure, develop a shorter version of the measure, and those were our three aims. And PCORI came back to us and said, we really would like you to add a fourth aim to this project before we fund it. We really want you to do an implementation piece. And so we added this fourth aim to our study, which was a small sort of implementation study to see how our measure works in practice. So we had a really aggressive timeline where we sort of grouped our ideas or our measure into three sort of bins. The first one was to really validate and refine the measure, and then we were sort of evaluating and testing the measure. And in the last phase, we were implementing the measure in practice. Luckily for us, we were already doing web-based surveys. And so when COVID hit, I'll talk about, it did have some implications for us. We didn't have to change our study design in ways that I think other studies did, but it definitely did have some implications for our study. So we started our study with the Delphi process. And for those of you who don't know, the Delphi technique is a method for collecting and organizing informed opinion from a group of experts using an iterative process. It is often used in survey development. And we thought this approach was appropriate to ensure that feedback was obtained from all stakeholders, with all stakeholders being treated equally and everyone's voices being heard. And this is really important in our case because we had both experts who were academic researchers who were doing community engagement, but we also had community health stakeholders who were participants or partners in academic research. We wanted to make sure that everyone had a say in how we were developing the measure. And what I really liked about the Delphi technique is that it afforded us a stakeholder engaged measurement development process. And really for our validation, which I think this is really important because lots of times we don't include the population who the measure is designed for in the development process. And now that we think about it, it makes total sense, but we thought that this was like really good for us, particularly in this space that we were in. So we conducted our Delphi process primarily via web. So we had rounds 1, 2, 3, and rounds 5 were web-based surveys. And round 4 was an in-person meeting, but we did use some polling software. And the responses to surveys were analyzed by the investigator team and returned to the Delphi panelists for further consideration and response. And the way the sort of Delphi process works is that in each round, the goal is to reach consensus. And for us, that was greater than 80% agreement among our experts. And in subsequent rounds, items where consensus is not reached in previous rounds are provided along with anonymous feedback from the previous iteration. And the way that we did this is that, so the person saw their own response, and then they saw responses for the group as a whole, but then also stratified by whether the responses were coming from academic researchers or from community health stakeholders. And panelists are encouraged to reconsider their previous responses and, if appropriate, to change their previous response in light of the replies and comments from other panelists. That being said, consensus was not forced. So items for which consensus could not be reached were discussed at the in-person meeting. And I don't do really, really smart things really often, but one of the smart things I did was to invite an editor to our in-person meeting. So I'm a biostatistician, words are not my strong suit. And I think we were able to reach consensus in the in-person meeting mainly because she was there, and also because a lot of the inconsistencies were around definitions and language and wording, and our ability to revise some of the definitions, language, and wording is how we were able to reach consensus. So we spent about a year doing our Delphi process. We started at the end of June 2017, and we finished in the end of August of 2018. And one of the things that we noticed really early on was that we needed to focus on definitions. We were not going to reach consensus if we didn't have an agreement about what things meant. And so we focused a lot, not just on what the engagement principle was, but what we thought that that engagement principle meant. What is the definition of that principle? And then the items that correlate with it. In addition, we talked about different classifications of engagement, so where projects fall across the spectrum, and I'll talk about that more later. And also we developed some scenarios that fit each of those classifications, and some that were sort of in overlapping spaces to really get a sense of how people thought about engagement and how to classify the engagement in meaningful ways. So our in-person meeting was really helpful, but everyone couldn't attend. And so part of what we did, and because there was some definitional language changes, we added the 5th round. So we had planned for 4 round Delphi process, but we added the 5th round, which is really just a consensus round that gave people a chance to see the final wording of items, definitions, scenarios, and etc. I'm not going to spend a lot of time, but one of the major challenges for our Delphi panel is we really asked them to help us cut down the number of items. In our initial measure, we had 48 items measured on 2 different scales. So the number of items was laborious for any participants. And you'll see in round 1, there was lots of changes. So there were only 4 items that weren't changed. We dropped 16 items. We added 13 items, and 28 items were modified. And the only caveat is in our add dropped or modified, sometimes we're moving things from one engagement principle, an item from one engagement principle to another. So by round 2, we had 43 items. So we were able to drop 5. In this round, 13 were not changed, 7 were dropped. We didn't add any because we were trying to reduce the number of items, and 23 items were modified. It's also important to point out that we moved from 11 engagement principles to 8 engagement principles. 4 were dropped completely, most were modified, and 1 was added. And so the engagement principle around building trust was added in this round. It was something that our community partners, our Delphi panelists, felt was really missing for the measure. So by round 3, we had 36 items. There were 20 not changed, so we're making progress. We dropped 5, we added 2 here, and 11 were modified. And in rounds 4 and 5, we started with 33, 23 were not changed, 3 were dropped, 2 were added, 7 were modified, and we ended this process with 32 items. So we started with 48, and we were able to get down to 32 items, which is still a really long assessment. And so I really have to thank our Delphi panelists who came to our in-person meeting. We hosted them at New York University School of Global Public Health. The meeting was in New York City in April, and we held them in a conference room with no windows for 2 days. And the weather was really nice outside, but they were really important and really helped us discuss where we were and helped move our process forward. We would not have been able to do this without their help. So we've started to release some of the papers about this process that we went through in terms of reaching consensus on what we even wanted to measure. So reaching consensus on the principles of stakeholder engagement, what principles that we wanted to measure. So as I mentioned, we named our tool the Research Engagement Survey Tool. It's really cheesy, but in terms of marketing, we think that telling people to stop and take a rest, which means stop and really take a look at your engagement is really important. And so the 8 engagement principles that we measure in our tool is focus on community perspectives and determinants of health. Partnership input is vital. Partnership sustainability to meet the goals and objectives. Foster co-learning, capacity building, and co-benefit for all partners. Build on strengths and resources within the community or patient population. Facilitate collaborative, equitable partnerships. Involve all partnerships in the dissemination process, and build and maintain trust in the partnership. And so then the next phase is really, this content validation. So using the members of the Delphi process to really make sure that we were measuring what we thought we were measuring based on their expert opinion. So in phase 2 of our study, we did a longitudinal web-based survey. And these were of people who had participated in engaged projects across the community engagement spectrum. So we were able to consent 487 people, and we had 393 people complete at least one of the survey, and 324 completed all 4 surveys. And you might notice that the surveys were coming out sort of in rapid time, July 2017, November 2017, March 2018, and then there was a big gap between our 3rd and our 4th survey. And what we were doing in that time was conducting these cognitive response testing interviews to ensure readability and understandability of the measure. So even though we use a stakeholder engaged development process, one of the things I didn't show just for lack of time was the demographics of our Delphi panel. It was really variable, but one of the things was that we had a highly educated panel. And so we wanted to make sure that our item would work in lay audiences. And some of the results of this cognitive testing showed that. So there was literacy and interpretation concerns, particularly on certain words. We were using words like dissemination and governance and intellectual property and capacity. It's not that people didn't know what these words meant a lot of the times, but they didn't really know how we were using them or understanding how we were using them. There was also some confusion in terms of our question stem. And even though, I teach survey methods, we still ended up with some double barrel questions. And we were discussing how did this happen? But part of reaching consensus was putting lots of things into things to make people agree or to help people agree. And so sometimes we ended up with really complex questions. And then the other thing that we did was to add a not applicable response option. So I'm a biostatistician. To me, not applicable essentially means missing data. And so I kept fighting, why do we want this? But it is true for certain phases in the research study, there's some of our items that really are not applicable. And so instead of having lots of real missing data, we thought it was important to have that as an option. And so we modified the measure based on cognitive response testing, which was then released in the final rounds, final wave of our longitudinal study. So our survey participants were predominantly white and Black. We did not do a great job of recruiting Hispanics, Asians, or other racial ethnic groups. Our participants were primarily female, and originally we thought this was like a really bad skew, even though we know that there's some data to show that women are more likely to participate in research. One of the things we've learned from our community partners is that their partners in research also tended to be female, so really skewed female, and so this sort of made sense to us. And then again, our sample is fairly well educated. So we originally started by thinking that we would just recruit participants from Washington University in St. Louis, where I was at the time, and then the University of Washington, where one of our collaborators was. But right before funding, I moved back home to New York, and so we said, oh, we would collect data in New York. But one of the things that came out in our Delphi process was people were talking about people are doing engagement all over the country and in different ways, and we may want to expand our sample. So we sort of expanded out of our sort of 3 sites, and we were able to recruit participants from lots of states, but we had 12 states where there is no representation. And it was nice to see that the response to our survey were affiliated with 177 different universities. We're only listing the ones here that had more than 15, and you can see there's lots from Washington University in St. Louis. I had been there for 6 years doing lots of engagement work, so it was sort of really easy to recruit participants from there. And then I recently moved to New York University and started doing some engagement work here. But it was nice to see places like University of Alabama, which weren't affiliated with our study, and Northwestern and the Mayo Clinic really get some good representation in our study. So one of the first things we wanted to do and when examining the psychometrics of our measure was to examine internal consistency. And we used Cronbach's alpha to examine internal consistency. And really internal consistency, at least for us, I mean, what it is in general, but the way we were doing it is we wanted to make sure that the 3 to 5 items that we're measuring an engagement principle were internally consistent with each other. So if they're measuring the same principle, there should be some consistency in those responses. And we were able to see that our measure had really good internal consistency on both scales, quantity and quality, for each of the engagement principles. And there's a little bit in terms of engagement principle 7 about dissemination. You can talk about a little bit later. Also, because we were trying to validate a measure for which there was no gold standard, we had to use different sort of validation approaches. And one of them was correlative validity. So does our measure correlate with other measures that we think, that we hypothesize that it should correlate with? Because we were using Likert type response options, our data was skewed, so we used Spearman correlation coefficients instead of Pearson, which is just a non-parametric version of Pearson's correlation coefficient. And we looked at the correlative validity of our measure with several measures in the literature. Particularly, we were interested initially in how our measure was correlated with medical mistrust. We thought that when there was more trust, there would be more engagement. And so we used the medical mistrust scale. We also used the trust and medical researchers scale. But we also pulled out some other engagement scales. Like I said, there were other things being developed simultaneously and a few that were in the literature. So we compared it to the Community Engagement and Research Index, the Partnership in Community-Based Research measure, and the Coalition Self-Assessment Survey, which had different scales, trust and our trust. We're looking at the correlation here with this and just our trust engagement principle. And as you can see here, they're all statistically significant, but the correlations are either negligible or really low. Then we looked at a few other measures. So Kagan has a measure of engagement. There's also a synergy scale of the partnership self-assessment tool, a satisfaction scale. And then there's also a collaboration scale that has been developed by Wilder et al. And these showed more moderate correlation. And so we're really excited about these. And that is because we wanted our measure to correlate with these other measures, But we think the fact that there's no high levels of correlation show that we are actually measuring something different than what these measures are measuring, which is what we hypothesized initially. So it is correlated with these things, but it's not so correlated that we actually feel like we're measuring the same thing as what these measures are measuring. And these are just the references for the measures that we used in our correlative validity study. So we recently released a paper on the strategies of community engagement, where we really talk about our definitions of the different levels of engagement and how we're classifying that level of engagement. So we started by, I showed you again, we have this sort of stack tool, and we started thinking that community engagement was a spectrum. So if you tell a biostatistician something's a spectrum, they put it on a line in a linear way. And we thought, sort of started with outreach and education, moved to consultation, then cooperation, then collaboration, and then partnership. But what we were sort of seeing in practice when we asked people to classify studies, and then so on our survey, people were asked to classify based on our definitions what level of engagement their project was in, but then we also looked at the scores that they gave their project using our tool. And one of the things you'll see here is that outreach and education has higher levels than consultation, and in some cases, at least on the quantity scale, even cooperation. And we were trying to figure out why this was, but it also came up in our cognitive interview that community stakeholders are talking about the benefit that they get from outreach and education that is done. And it made us sort of rethink how we've been thinking about engagement. So this is sort of our new approach. Again, if you give a biostatistician something, I move from one axis to two, because not super creative. But we really think about engagement now in two ways: what the non-academic partner is inputting into academic research, and then also what they're getting out from academic and research. And we think this outreach and education, while there's not a lot of input from the non-academic partner, there's potentially a lot of benefit to non-academic stakeholders. So we think that's higher on our y-axis and lower on the x-axis, a little bit out of sync with how we've been thinking about sort of this linear relationship that existed. So this is our current thinking, but it's always up for debate. This is how we kind of see the classifications going. And then, as I mentioned, we went from 48 items to 32 items, still too long of a measure to convince other people to use. And so we really wanted to focus on developing a condensed version of this measure. And we used several methods in determining which items to cut. We looked at the amount of not applicable and missing responses for questions we received. We used factor analysis, looking at cross-loading, non-loading, and low-loading items. We looked at the distribution of responses. We even did some item response theory analysis, looking at slopes and threshold ranges. And then in terms of some of our more qualitative stuff, we looked at so we asked those who took our cognitive interviews to rate how important they thought each engagement principle was, and then also how difficult of a chance they had on looking at the items. And we also had to ask our Delphi panel to rate the importance of each engagement principle. So we used all of these different sources of data to figure out which items we could potentially cut. And so results show promise for a 9-item version of our measure, which we think is a great reduction down from the 32-item measure. And this 9-item version of our measure is highly correlated with the full version. And the overall NEP and engagement principle specific means are similar between the two versions. So you'll see that our condensed version and our full version have really strong correlation, with a Spearman correlation coefficient of 0.97 on both scales. But also that the way it performed was really similar for both scales. And the other thing we looked at is how it performed for each engagement principle. You'll notice here that engagement principle 7 is missing because it's not measured in our condensed measure. So our condensed measure has 9 items. Most engagement principles are measured by 1 item, but there's a couple that are measured by 2 items. We actually had 2 versions of the condensed measure that we were testing in practice, but ultimately now we've decided on one of those versions to move forward with. So we also noticed that our item had some differential functioning by demographic characteristics. And we expect some. We expect that males and females may respond differently. We expect that those in different racial ethnic groups may respond differently, and those in education may respond differently. And we're really comparing the level of differential functioning in our measure compared to the other measures that we use in our correlative validity, because we just wanted to make sure that there was no systematic bias in our measure. What made us really think about this is when we were trying to use imputation for missing values, we noticed that there was some systematic error that we were starting to see in our imputation process that led us to think about trying to make our measure be as unbiased as potentially possible. So in testing this differential functioning, we used ordinal logistic regression, and the first model has the item as the outcome and the score as the predictor. And a second model has the item as the outcome, the score as a predictor, and then a potential demographic variable, let's say gender, as a potential moderator. And we conducted likelihood ratio tests to compare the likelihood of the two models using the chi-squared distribution. And we did this as an iterative process of testing different items within the same engagement principle by demographic groups and retesting until there was no further evidence of differential functioning. And so, this is just a quick way to show you some of the items where there was differential functioning. So on our quality scale, we had two items, one where we saw differential functioning by race, ethnicity, and one where we saw differential functioning by education. And we were able to swap it out with another item and ultimately get rid of the differential functioning. The reason why this is an iterative process is because you may get rid of the differential functioning in one item and cause differential functioning in another item. So you have to keep going through until you are able to be there. We saw a lot more differential functioning in our quantity scale. Here we saw by education, by gender, by race, and by education, as I mentioned. But ultimately, we were able to find substitutes of other items within the same engagement principle that when we added it, differential functioning was not shown ultimately. And our adapted version, our condensed version, really worked well relative to the full version and perform really well in terms of how they compare to how the full version of our measure is performing. And we pilot tested the adaptive measure among partners of our research team. Our survey was launched in July of this year and closed in August. We had just a small sample of 29, but preliminary results show that the adaptive version of the measure is feasible, although I'm a statistician, so I feel like there is still some room for improvement and more testing would be needed to do that. But our pilot testing shows good internal consistency and performance in the study. And then our last phase of the study was this implementation phase. And we wanted to evaluate the stakeholder engagement measure in practice, examining the implementation and performance in patient-centered outcomes research and comparative effectiveness research studies. We wanted to examine the uptake among research teams, barriers, and facilitating factors for use of the research.
Gloria, can you, I think she already did.
Okay, sorry, I was muted. Examining the uptake among researchers, barriers, and facilitating factors for the use of the tool in practice and best practices for implementation. And we use the consolidated framework for implementation research framework to form our implementation study. We're really looking at sort of the characteristics of the intervention. So how are we getting people to actually put this and use this in their studies? The outer setting, the inner setting, characteristics of the individuals involved in the process of actually getting other teams to use our measure. And this information is really useful to us as we refine tool administrating guidelines, procedures for implementing the tool in practice, and really for us, how we're going to package and disseminate our tool for research teams to use. So I will say that the COVID pandemic happened during our implementation study, and we think this impacted some teams from participating. And we originally had planned 2 partner web surveys, but even without COVID, when we were asking about barriers and facilitating factors of project teams, they thought 2 surveys were too burdensome on their on their partners. So we decided to only do one of the partners. And then we did two of the project teams. So a baseline survey just to get a sense of how much engagement they're doing. Did they have any projects that were relevant to our study? But then also at the end, we gave them reports and information, and we wanted to know how useful they found. So we had 86 teams complete baseline surveys, and 36 teams indicated that they were interested in implementing the rest. We had 20 teams implement the rest across 26 projects, so some teams had more than one project. And we had a median of 5 teams complete per project with a range of 1 to 26 partners. I mean, 178 partners complete the measure across all teams. So project teams were able to indicate whether they wanted a detailed project-specific report on REST, like whether they wanted to know how well their community engagement was going, a report comparing their project to all the other, the average of all the other teams in the study. And for teams who had enough data, we even gave them back raw, specific de-identified data. So for teams that had at least 5 partners completed, they were given the materials requested. If they didn't have at least 5, they were just given a report that gave the average of everyone. We didn't want to out any of their members with giving them their data. And we did follow-up web surveys and Zoom interviews with a subsample. So all teams who implemented the REST did complete the follow-up survey. And we had about 13 teams. We only wanted to do a subset, complete qualitative interviews, just so we could get additional feedback on the experience of using the REST in practice. So please don't blame COCORI, its Board of Governors, or the Methodology Committee for anything I said here. And I really have to thank all of our collaborators who've gone through many phases, those who worked on the systematic review, and also those who worked on the COCORI funded study. And I'm happy to take questions. And I think I actually left 15 minutes like I was supposed to. I will stop sharing and turn on my camera. Okay.
Thank you. This is Maureen. Can I jump in with a question? Can you hear me okay?
Yes.
I guess we could use the hand raising thing too, but that would require somebody. Thank you for that wonderful presentation. And I had always thought it was the Likert scale. So thank you for correcting my pronunciation too. Never heard it called Likert before.
Well, you know, that's how he pronounced his name. So I'm trying to be respectful.
That makes sense. I just was wondering if, you know, one of the things we hear a lot about community engaged research is that it's, as critical as it is, it's not very efficient and it takes a long time. I mean, and so I think for funders, they don't realize it, you know, it's not built into budgets enough, how much time it takes to actually achieve this true engagement, and also in faculty promotion committees and things that, you know, so I'm wondering if you see any use of the tool to help really help that, you know, make it so it's almost unethical to do research that isn't, you know, community engaged. So it might be cheaper, but it's really not okay. I wonder if you see it used in any way like that.
So yeah, I think we've been saying that in your initial phases, you should use the comprehensive version. And it would give someone who's doing this type of work something to write about, like this is where our team started and this is where we hope to go. And so I do think for junior folks, it does give them an in to thinking about community engagement as a science. I don't think we're completely there yet in terms of funding or tenure and promotion, but I will say, you know, the development of PCORI is sort of a move in the right direction, that we're doing stuff that's patient-centered. And I also think the National Institute of Health has really started to focus on engagements in terms of looking for grants. So a lot of the COVID grants that just got funded had to have a community engagement component to them. I still don't think we're being honest about how long it takes. So I think the only people that were successful in getting those grants already had partnerships that were ongoing. But I do like what PCORI has done. So PCORI actually offers engagement awards, and those are grants just to develop research partnerships. So you don't have to have like a scientific study going on. And so I do think the idea of a funder funding you to like start the engagement process is a move in the right direction. That being said, you know, I don't know that I cannot do engaged research now because I really think that this has improved my science by leaps and bounds. And I'm okay with things taking a little bit longer, but I also know that I'm in a unique position as a biostatistician. I have lots of projects I could work on that are not necessarily engaged, or my role is in engagement to get the publications and the funding that I need. But this is my passion. I don't really understand how we're doing science on people still. We should be doing science with people. And so I think this is my soapbox. I could probably talk about this for a whole hour, but you know, I really do think that you know, there's this whole quote that you can't help people unless you serve them. And the idea that we are trying to help populations, but we're not engaging them in the process and really thinking about for them what type of help they want, but also how to develop things that are going to be used and also sustainable beyond funding. So I know that that's a long-winded way to answer your question, but the short answer is I don't think we're there yet, but I do think we're moving in the right direction. And I think there's enough people that are stubborn enough like me to keep doing this stuff. I was told as a junior researcher, don't do this type of work. I would never get promoted. And I still kept doing it anyway because it's what made me excited and it's what I wanted to wake up and do. And so I think there's enough of us who are standing on the soapbox and doing really good science in this space that is able to demonstrate that this is really an important way to go, I think, for those of us who are interested in working on types of problems that really engagement is a necessary component to move that type of science forward.
Thank you.
So I have a question. That was, first of all, I just want to say that was a beautiful presentation, and I so appreciate the rigor that you use to really work this tool and show and simplify it and validate it. And you know, I'm interested in hearing a little bit about how you think it can be used to follow engagement over time and what your experience has been with that, and how where you've seen it help iteratively to improve engagement in a project.
So we think in the initial phases that people should use the comprehensive version, but then if you're going to use it longitudinally, then you'd only need to use the condensed version or even take engagement principle or two. So one of the things, I didn't talk a lot about scoring because we're still working this all out, but the way that we're thinking that people would use our measure is that it tells you which principles you're doing great on and which ones you need improvement on. And so you don't really need to keep measuring the things that you're doing well unless you're going to change something in that space. But it gives you a chance to really focus on maybe we haven't been doing great at building trust, or maybe we haven't been good at focusing on what's important to the community and really focus in that space. And the way that we give people their sort of summary of their engagement back, it's sort of like if any of you guys have done 23andMe or any of these genetic tools, we sort of give them a tool back that says, your study is 5% outreach and education and 20% collaboration. And so you get percentages. So no one study is in one bin. That's not really how engagement works. And so it gives people a chance to really think about one, where they are and where they want to go. And I think the other thing that's important for me to say, because I think people get nervous when we start talking about level of engagement, is that the level of engagement needs to match your scientific question. Not every question requires high levels of engagement. And you really just want to make sure that you're in the right sort of category or space of engagement for the question that you're trying to answer. And not everyone's goal is to move engagement beyond where they are. But I think our tool allows people to do all those different things with it, right? Figure out where you are, think about if that's the right space for you, think about where you want to go. And what we found from our implementation study is that it has been a great discussion tool for partnerships. So when they get their results back, that's where the work is happening. When they're really talking about, why did we do well on this? Why are we not doing so well on this engagement principle? Well, how do we fix that? Is it important for us to be doing well in dissemination? Maybe not. Our project's not in the dissemination phase, right? And so to really think through what that means in terms of where you are in your study and where you hope to go, and to have an engaged conversation with your partners about, do you agree? So one of the things that we ask people in our implementation study is, do you even agree with the score we gave you, right? Do you agree with how we're classifying your partnership. And what we actually found is most people said yes. Most people said, yes, I agree with how this measure has has rated our engagement. And also, it was a great conversation starter for us with our partners in terms of us not only agreeing with where we are, but having the conversation about where we want to go. And one of the things I probably didn't mention is that that last category of engagement partnership, it assumes that you've done more than one project with this group of partners, right? So to be in that phase, you have to already be in a certain phase with your partners. And so I think it gives research teams a good idea about where they are, but I think it gives the partnership in general a good place to discuss why are we, what do our numbers look like? Why does it look like this? Where should we be for the project that we're in and how long we've been collaborating? And where do we hope to be in 1 year, 5 years, et cetera?
Melissa has her hand raised. So Melissa, would you like to ask a question?
Sure, and I'll put myself on video. It might be a little easier to talk to a person who you can see. So first, thank you so much. This was a phenomenal talk, and especially what you just said about doing research on people versus with people, I think is so important and really always important for us to hear. My question is really specific to one point in your process. When you talked about your brilliant idea about bringing in the editor to the group that was when you were really working through the questions together. It sounded like you, despite the best efforts, even getting maybe 3 or 4, I forget exactly how many phases in, you still ended up finding that you had some double-barreled questions, that they had come from trying to in part trying to sort of please people or get people into agreement. And so I was thinking about, is there some benefit to having an editor, for example, involved earlier to avoid that earlier? Or do you think that it's really, you kind of need to get that agreement, and some of the price that you pay might be having some of these issues that then need to be fixed later?
Yeah, so I think, I don't know what the timing would be, but I would say that we had taken out all of the double-barreled stuff initially, right? I teach survey research, so I thought about these things. But then as you're going through this process and you're trying to reach consensus and you're in those meetings and people start agreeing, you just start throwing stuff in there because we're reaching in agreements and it's working, right? And I think it was important for us to do that because even though we edited them back for like double-barreledness, we didn't change the content that was added in that process. We may have separated them into 2 items or, done some other sort of wordsmithing to make things work. But really, we needed that process to move the group to consensus. And we weren't trying to force consensus, but we really found that a lot of the lack of consensus was around I define this to be this way. I define a stakeholder to be this type of person. You are only using patients, but our stakeholders are health centers. And so a lot of that was around wordsmithing. And the editor thing is just because I'm a biostatistician and I like numbers more than I like words. And so I know what my weaknesses are. This Delphi process is a qualitative process. I pulled so much quantitative data out of this qualitative process because that's just what I do. It's sort of like, if all you have is a hammer, everything's a nail. And even though I've been in the mixed method space for a while, it just seemed right. And so I think the editor for me was a great way to have someone in this space when they really started talking about definition. She really knew what words meant. She had alternative words or language to suggest. I don't think we would have been able to reach consensus the way we did without her being there. And so she was a really integral part of the process. And then she really was an integral part in the process of helping us write the papers that came out of this because she was in that room. She's someone that I had worked with as an editor before and like a biostat book and some other things. But this was the first time that I was like, no, you were here. You know exactly what happened. So now you're not editing some project that I'm writing about. You were like in the room and in the space. And I think it really helped us around a lot of definitional things and a lot of just finding the right word. Because I think for a lot of this stuff, we were in agreement in theory, but we weren't in agreement with the language that was being used. And I will say, you hear me say stakeholder a lot because that's Pocori's term, but in our tool, the word that we use is partner. So it is a very broad term, and we did it that way for a couple of reasons. One is because there's not a lot of measures in this space, we wanted a generic measure. So our measure is not disease specific or population specific, other than that it's only in English, at least right now at the moment. And so because of that, you know, we wanted to have language that was inviting, no matter who your partners were, and no matter what type of engagement you were doing. And she was just, the editor was, like I said, I don't really have like super great ideas that often, but I just think the idea when I was like, we should invite her to this meeting was like the most brilliant thing that we've ever, because once we were all in there, I realized we would not have been able to do that without her there.
Thank you. If I may ask a quick follow-up to this, do you, because I've been in these projects too, where everybody agrees on a certain term when they use the term, but they're all using it to mean something different. Do you, looking back at this process, see that there might have been opportunities even earlier in the process to kind of hammer out some of these different terminology problems, or do you think that it kind of came in at the right place?
So yeah, it actually came in earlier. So originally we just wanted agreement on the engagement principles. And one of the things we learned early on is that we had to define, we couldn't reach agreement on those principles without defining what those principles meant. And so a lot of what the Delphi process was doing was agreeing on definitions of things, which wasn't our initial intention. You know, I'm a statistician. I want you to agree on the principle and agree on the items and let me move on with my measure. Right. And we did a lot of work about defining what this meant. And that's how we were able to reach agreement. And I think without that definitional work, we would have never been able to get there because like you said, we're all saying the same word, but we mean different things. And so for us to write the definition down on paper allowed us to see early on where those were and how to sort of reach consensus in that process.
Great. Thank you so much.
What do you think? Time for one more question? I don't see the hands. So is anybody raising their hands?
Melissa is.
I'm trying to put my hand down. Not sure.
Well, we are just about at the end of the hour. I don't want to end before we're done, but seriously, I don't see hands on my version of WebEx, so I'm missing something.
I'll ask one more question. I just was wondering, you know, because you've emphasized you're the biostatistician and you're working with the community, in any of your analyses, for example, in the Chromebox alpha analysis or whatever, if it didn't agree with what the Delphi group, you know, which one, sometimes, like you said, there's not a consensus. What if you found something someone really thought was important to include, but it really didn't add at all? What do you do then?
So luckily for us, we were not in that space, but one of the things that our project team decided early on was to stratify responses by whether they came from an academic researcher or a community partner. And we decided to hold the community partners' responses at a higher weight. So one, our Delphi process actually had more community partners than academic researchers. I think it was like 8 to 11. And that was a decision of our funder to have that imbalance. But two, we decided early on that we really wanted to listen to the community partners in a way. So even if one person only said something, we had these bars of like what we would change. We really looked at what they said, even if it wasn't in our classification to make a modification. We wanted to make sure we understood what their concern was, and try to make sure that we addressed it in some way. I think we were lucky in that, you know, the numbers part really worked out. But I do think, at least for myself, one of the things that this has made me think about, and where I think my research is going to go in the future, is to really think about how we triangulate data that come from quantitative and qualitative analysis. Because this project had so many different types and quantitative and qualitative data, and we were sort of doing this as a project team, I think the way everyone else does it, it made me really think about, when people tell you to triangulate your data, there's no method that shows you like, this is how you triangulate data. And it really made me think about, this is a space where I think methodologically we need to do a little bit more work, just because we were lucky, I think, and then our qualitative and quantitative data were in agreement. But we did have a lot of discussions about, before we even went in, like, what are we going to do if these things don't agree? And when we looked at the literature, there's not a whole lot to tell you what to do if your quantitative and your qualitative data don't agree. So I think that's sort of my next methodological challenge, is to really think about this idea of triangulation and how to really make it more methodologically sound. Because I think a lot of it for us was just conversations and like trying to work through as a project team. And I think we had enough people, quantitative and qualitative researchers on our team, that we were able to do that. But I think we were lucky in that we saw a lot of agreement. I really don't know what we would have done if there was like a lot of disagreement going on. But I will say nice about that, because in the beginning, when we didn't have agreement, the answer was put it on the next round of the Delphi process, right? So we just kept sort of putting it back to our panelists to have conversation about.
Great. Well, we're at the end of the hour. This has been a fantastic seminar, and we're really looking forward to further discussions this afternoon. So I don't know how we all say
Thank you guys
wonderful,
for having
but
me.
thank you so much.
Bye.